for us. We're really excited that we've been able to offer these webinars to you each week on a variety of topics. We get a lot of questions about project implementation, so we thought it was very apropos to cover this topic today. And before I get started, I just wanted to go over our disclaimer. Nothing that we share with you is intended to be legally binding or prescriptive. And the presentations that we put together are syntheses of information that is available publicly, as well as based on best practices and our own experiences with, in the industry. So with that said, we'll talk about project implementation. So this is, if you've been attending our webinars for the last few weeks, you've probably become familiar with this roadmap that we've been sharing. Given all the different changes that the healthcare industry is going through this year, we feel that this is the optimal roadmap for getting organizations to where they need to be by the end of this year. So we're already, believe it or not, midway through Q1 of 2014. So hopefully you're somewhere, you're past finalizing the plan for 2014, and hopefully most of you who are on NextGen have already installed 5.8 in your test environment, maybe even gone live in production, and either already have or about to install KBM 8.3 in a test environment so that you can determine what the optimal upgrade path will be. And the next quarter, it is going to be all about the KBM 8.3 upgrade, as well as starting to test claims with clearinghouses as well as with payers to ensure that your ICD-10 functionality is working as expected. And then Q3, if you have everything else in place, and if you are attesting to meaningful use stage 2, and you have your portal in place, then you should be ready to attest to meaningful use in Q3. And also start training your providers and staff on ICD-10 implementation. October 1st is the go live for ICD-10. As of now, there haven't been any changes announced to that schedule. And then if for some reason you were wanting to attest to meaningful use stage 1 or 2 and you failed in Q3, you have Q4 as a makeup quarter. So I wanted to talk about what a typical project life cycle looks like. And if you go into a Google search, you'll probably find lots of really different models, some very, very complex. But essentially what the project life cycle boils down to is 4 key phases. One is the inception of the project itself, and I'll talk a little bit more about what in each of these phases entails. Then there's planning, the execution, and closure. The project inception basically is the outcome of a group of objectives, which basically tell you why you want to work on a project. So for 2014, given all the regulatory changes that the healthcare industry has to adopt, the objectives would be something as simple as ICD-10 compliance or meaningful use 2 compliance. And then your project inception also needs to consider, excuse me, what your project deliverables are going to be. What will your project be producing? And lastly, the plan. How will you achieve everything that you are setting out to achieve in your project? And this breaks it down into tasks and timelines as well as people and resources. So one of the really, really crucial things for any project and an aspect that often gets overlooked is project governance. So there's some ambiguity around what project governance is and how is this different to organizational governance. The difference between the two is that organizational governance is responsible for the day-to-day functioning of the organization, whereas project governance focuses on specific projects, and the governance hierarchy may be quite different to a typical organizational hierarchy. the whole purpose of having governance is to provide a decision-making framework for all the different entities that are involved in executing the project. It's essentially a very clearly articulated master plan that lays out the structure of the project, the people, and there's a big emphasis on communication. It also assigns accountability, and typically the accountability is at a level where the success of the project is drives an individual's ability to either stay with the organization after the project has been completed, or if the project is a complete failure, for him or her to basically not be able to stay with the organization. So it is something that's taken very, very seriously. It's really important to also remember that project governance separates stakeholder management and project decision-making activities. So often the two get conflated, and so it's important to remember that one of the objectives of project governance is to keep a clear separation between the two. And then lastly, like I mentioned earlier, project governance, you need to ensure that the project governance is separate from organizational governance structures. And this is a very loose and perhaps a very simplified example of what a governance structure looks like. But essentially, these are the key elements of a governance structure. You have an executive sponsor, and this is the individual whose professional career ought to be at stake and tied in very closely with the success of the project. And it doesn't have to be, in very, very few cases would this position be occupied by a chief executive officer or an executive director. This would typically be somebody from within the C-suite, or perhaps even from somebody from the board of directors. Then there's the project director, and oftentimes when the project has an IT flavor to it, there's a tendency to look at it as an IT project. But like the implementation of an EHR system, for example, or upgrade of an EHR system, is not an IT project, contrary to what people may believe it to be. 80% of this project is actually tied in with processes and with people. So it's important to make sure that the project director is somebody who is able to drive the progress of the project, but isn't necessarily seen as the primary stakeholder of in the project itself. And then you have a variety of stakeholders. These could be clinical stakeholders, front office, back office. With one clinic that I'm working with, they have a very strong funded programs division, and so there would be stakeholders from that. So whatever your organizational structure is, you need to make sure that every major group is represented amongst the stakeholders. So this is the project implementation life cycle, and this is really where I'm going to be spending most of this presentation. Perhaps the most important stage or phase of the project implementation life cycle is project planning. And this is, it's a circular process, but at some point in time, everything sort of has to go back to project planning, because unless you have a really strong project plan in place, the chances are that the outcomes would, it would be very difficult to stay focused on what the outcomes need to be. An equally important aspect of implementation is doing a workflow analysis, then testing, training, the go-live, and post-go-live optimization. So before I talk about workflow analysis, I wanted to spend a little bit of time talking about project planning. There's there are a variety of tools that are available on the market. There's Microsoft Project. There are some free tools available as well. When you think about project planning, it's really not that important to get too hung up on what tool to use, because the tool is really supposed to support the process. What's more critical is knowing what it is that you are setting out to achieve, what your milestones are going to be, who's going to be involved in the process, what the timelines are for the various deliverables. And that's really all you need to know. There are very successful projects that have been managed using something as simple as Excel. So it's more about the process than it is about what tool you use to monitor your progress. The other really important thing that oftentimes gets overlooked in project planning is contingency planning. Nobody wants to think about a project failing, but unfortunately, a lot of IT-oriented projects typically, I think the statistics are really alarming. 7 out of 10 IT-oriented projects tend to either fail entirely or are over budget or delayed. And part of that reason can be attributed to the fact that there isn't a contingency plan in place. So if, for example, you were planning on going live at the end of March, and for some reason that go-live plan fails, unless you've already thought out a contingency plan, the chances are that your project could risk failure. And this is not meant to be a doom and gloom sort of a situation, but it is a reality. And one of the ways you can try and prevent something like that from happening is to think it through before embarking on the project. So workflow analysis is basically a critical evaluation of current processes. And if this is something that your organization has not engaged in, and all your workflows are basically, they've just been handed down from one generation of employees to the next, this would be a good time to do a very comprehensive workflow analysis. And in the implementation process, this is something that needs to happen before you start looking at doing any kind of testing. For a lot of organizations who've been on EHR for a particularly long period of time, workflows have evolved, but there hasn't been any documentation of how these workflows have evolved. Similarly, because they've been on EHR for a long period of time, they've just been doing things the way they were doing them, and there hasn't been an opportunity to actually step back and look at whether those workflows are optimal or not. So going in for an upgrade, as I'm guessing most of you are, this is a really good opportunity to look at your workflows and see where there might be opportunities for improvement. One of the cool things about workflow analysis is that it provides you with a structured methodology for looking at who does what when. And again, with this, you can get very sophisticated if your organization embraces lean thinking or Six Sigma. You can get very sophisticated with the tools that you use to do a workflow analysis, or you can do something as simple as using, a white 8.5 by 11 and simply documenting the flow of what goes on in a particular process. The important thing to remember, though, is that you want your workflow to be representative of what actually happens on the floor, as opposed to what a particular manager may think or hope the process looks like. And so the best way to approach that is to bring all the key stakeholders together, and these would typically be your frontline staff who would execute the processes on a daily basis, and have them give you input into what the workflow really looks like. And starting out, if you don't already have any workflows in place, then you want to document what goes on currently before you can start looking at what's going to happen in the future post-upgrade. If you don't have workflows in place already, then this would be a good time to start documenting them. It's a time-consuming process, and it can become really tedious, but it's important. It has a lot of value. One, it allows you to really stay focused on continuous quality improvement, because you can always go back and revisit where some part of the process is functioning suboptimally. And it also serves as an amazing training tool. So anytime you have a turnover, you have somebody new joining the organization, you have a documented process which facilitates learning. And then the next part of doing a workflow analysis, of course, is what is this workflow going to look like after you've implemented, after you've upgraded your EHR or your practice management system. If you are a next-gen client, then you will be doing both this year. And being able to identify what your workflow is going to look like post-implementation is something that's going to help with the training again. And like I said, this is also a really, really good opportunity for you to look at what parts of the process may no longer be adding value, and they can be then taken out of your workflow so you can make it more efficient. And then during implementation, what you may find is that your future state workflows may still need to be refined a little bit, because perhaps as you implement your EHR or EPM, you may find that something that you had anticipated cannot actually be done in a very efficient way, or conversely, something that you hadn't anticipated may present itself as an opportunity for you to incorporate into the workflow. And at any point in an organization's evolution, workflows typically tend to be live documents, living documents, so they keep evolving as well. The other key piece of doing an upgrade is testing. The primary purpose is to see whether the application is working as desired, and also if it meets the stakeholders' needs. Ideally, you're testing based on a well-written plan, which gives you the different test scenarios that you need to be able to test, and also it gives you timelines in terms of what you need to accomplish by when. There are different methodologies that you can use for testing. Some organizations prefer to focus on regression testing. Others will do user acceptance testing. So whatever methodology works the best for your organization, it needs to be thought through before you put together your testing plan. And then having lots and lots of test cases or scenarios which allow users to walk through what a typical encounter would look like, or what a typical billing case would look like, or a check-in. Without these test cases, you would be really hard-pressed to be able to ensure that the application is working the way you want it to. And then you need to have a process for issue escalation. This needs to be very clearly defined. Ideally, you have a policy and procedure in place for testing and issue escalation. And then, of course, there's change management, which ties in with testing, because there is a very strong likelihood that there may be issues that are identified during testing that need to be escalated, and that may require some kind of a change to the application, whether it's a configuration change or whether it's an enhancement. Training is another important aspect of project implementation, and one of the key things with training is timing. That's always a difficult decision to make, because you don't want to train your staff too soon, because then you run the risk of them forgetting what you've trained them on. Similarly, you don't want to train them too close to the upgrade or to go live, because you want to give them enough time to be able to get enough hands-on practice. With upgrades, it's not, timing is, it's probably best that you schedule trainings closer to your go live as opposed to too early in the process. And then scheduling is something that you probably want to start working on several weeks in advance, especially when you're thinking about training providers, because you want to be able to block their schedules without affecting your patient flow. And then identifying what resources you need to have in place. Are you going to be doing the training in-house? Are you going to be relying on some outside resources, making sure that they'll be available when you need them to be? Training materials is another important takeaway. A lot of times the training material doesn't really serve as an after-the-fact reference book, which is really what it's intended to be. If somebody forgets a particular step, ideally they should be able to go back to the training material that was given to them and be able to retrace the correct way of doing a particular either an encounter or whatever they're working on. The methodology is also really important. This is, are you going to be doing in-person training? Is this going to be a web-based training? Are you going to have are you going to mix methodologies? Is part of it going to be in person? Is part of it going to be online? So all of that needs to be thought through. And again, even though the training itself may not occur until closer to go live, you want to be able to plan several weeks, if not months in advance. And then you need to be able to reinforce whatever employees or staff have been trained in. So this could include something like a proficiency test or some way to ensure that how a staff member has been trained on using NextGen is really the way that he or she is using it. As we know with NextGen especially, there are several ways of doing the same thing. And so if your organization has a particular process to follow, then you need to constantly reinforce it. Maybe not constantly, but consistently. For Go Live, it's always a good idea, even for an upgrade, it's always a good idea to do a mock Go Live a few days before the actual Go Live. And then having a night before checklist is another really useful tool. It allows you to document everything that you need to ensure is in place before Go Live. On-site support, making sure that you have somebody who's clinically well-versed, somebody who's technically well-versed available, so if users start to panic because something isn't going the way it should, you're able to address those concerns on the go. And then again, I talked about this earlier, having a contingency plan for a failed Go Live. It is possible. We don't like to think about stuff like this, but it is possible. And so the best way to deal with something like this is to plan ahead. And then having an issues log for Go Live specifically, because it is very possible that issues may come up that did not come up during testing and that did not come up at any other point in time, but this suddenly surfaced during Go Live. So you want to be able to maintain an issues log. And then you have your post-Go Live optimization. So once you've actually implemented the upgrade, you may find that there are ways in which you can make some minor tweaks either to the workflow or to the template even to facilitate an improvement in how some transaction is carried out or how the work is carried out. So that, in a nutshell, was basically what I wanted to share with you about project implementation. For a lot of organizations that we're working with, they installed EHRs several years ago, some as far back as 15 years ago, and they've never really gone through this kind of a project. And so they're kind of, at a loss with what they need to do and how they can prepare. So our intention behind today's webinar was really to give you some suggestions for what you can do to try and make sure that your project is successful. and also so that you can think about a lot of these things before the fact, rather than having to deal with them in the throes of some, major chaos. So with that, I just wanted to share with you, we've been putting together a number of white papers that talk about some of the topics we've already covered during our webinars. So you're welcome to go check those out. And then we're still building our library of white papers, and we will continue to add that. So you should be able to see different topics, and it gives you like the background on each of the topics being discussed, and hopefully makes you better informed. And that was it for today. If you have any questions, since we have a much smaller group than we usually do, I'm going to go ahead and unmute you all, and so that way we can, perhaps have a more interactive discussion. You're welcome to ask your questions, and maybe we can share and learn from each other. So, I've unmuted everybody. If you want to begin a discussion or you have a question, feel free to go for it.
Hi, this is Ken Rodriguez with Florida Women Care.
Hello.
Hi. So I think it's great that you have these white papers available. Where exactly on your website could I navigate to find those?
So, Stefan, I know you're on the call. Did you want to answer that? Stefan. We have them on our website. Actually, let me show you. I can navigate there, and I can show you.
Okay.
So,
Hey, Sammy, did you hear me now?
yes, thank you. I was trying to figure out how to, I was hoping you might be able to tell us how to get to issues.
I'm sorry about that. I was using my phone for the audio, and I thought you could hear me through my screen. So actually, to get to the issue website, the best thing would be is that we update our links, which I could take care of today, actually. So if you show them that screen that you just had on just a moment ago, what we do, right there, yeah. I will go ahead and update those links to direct to the issue website. We're actually putting our white papers on issue to take advantage of their PDF capabilities. So if you just give me about an hour after lunch, I'll be able to get that updated.
Awesome. Thank you very much. So, yeah, you would just go to our website, and then you would click on what we do, and these white papers here. We currently have 3 of them: Understanding the Impact of ICD-10, Meaningful Use Stage 2, and Physician Quality Reporting System. These are available on this website that we actually publish these on because, like Stefan said, they allow us to take full advantage of PDF capability. So, yeah, you should have that by the end of the day. Any other questions?
That's great. And by any chance, I have one more.
Yes.
Are these webinars by any chance recorded?
They are. Actually, today is the second one that we're recording. We started recording last week, and they're available on our YouTube channel. So in the invite that we send out, we're also starting to include our the link to our YouTube channel, but it's basically youtube.com/Quirk Healthcare, and I'm happy to show that to you too. So this is our channel, and this is the webinar from last week, and I'm recording this today. Once we're done with it, we'll upload that. And so we're starting to build a library of our webinars. Initially, we had made a decision that we were not going to record them, but we've just been getting so many requests that we finally started to do that last week.
Okay. Okay, thank you.
You're very welcome. Any other questions? And it doesn't have to be related to the topic we discussed today. If it's any, if it's related to any of the other topics or anything you want to talk about, feel free to speak up.
That was very informative. Thank you.
Thank you. So can I throw a random question out at you and see if any of you want to respond? Have you started your upgrade process if you're on Next Gen, and how's that coming along? Nobody wants to share? All right. Well, if there aren't any other questions, because I'm looking at my chat and I'm looking at my Q&A panel, I don't have any questions. If there's nothing else that you want to talk about, I'll go ahead and wrap this up. Thank you very much for joining us. We'll see you next time. Bye-bye.